And now let me introduce our next speaker, who is Dr. Nikhil Dongarkar, an experienced Ayurveda specialist currently practicing at the Santulan Om Health Resort in the German federal state of Baden-Württemberg. After completing his medical studies in India, he trained with renowned physicians, later running his own Ayurveda practice and bringing his expertise to Europe. Dr. Dongarkar is highly valued by his patients and spa guests for his precise assessment and his warm, approachable manner, making complex Ayurvedic concepts clear and accessible to all. We are pleased to have Dr. Nikhil Dongarkar with us online. Good afternoon to Germany, sir.
Thank you so much. Thank you so much. And good afternoon to you too. Is it audible from my side?
Yes, we can hear you perfectly and see you perfectly as well. The floor
Thank
is
you so much.
yours.
Thank you so much. So, first of all, I would like to thank the organizers, Dr. Thomas and his team, uh, the organizers of the World Health Congress, for giving the opportunity to speak on the topic what we are presenting today on migraine. As well as I would like to thank my co-authors, Mr. Sanjay Tambe and Brigitta Heinrich, for contributing to this study. So I will just share my presentation and start to begin with. So today I'm going to present the topic on migraine, that is the effectiveness of Ayurveda Panchakarma therapy in the management of migraine. So, as we all know, migraine is one of the leading factor right now in global, where almost 16.6% of the global population is continuously getting affected, and it is one of the seventh leading cause of the disability. So, most of the women specifically, I would say, that is, women affects three times more than the men, and as woman is a part one of the most important integral part of our society where they take care of uh, many aspects, I would say household aspects as well as in the professional aspects also. They are a leading workforce also. So it definitely creates a disturbance in their life as well as it creates disturbance in the surrounding people around them. So considering this one of the point where uh, majority of the population is getting affected, we thought that Ayurveda can give a better result, as well as Ayurveda can definitely help to mitigate this problem from its root cause. And that's the reason why we are now focusing, especially in our center in Germany, for migraine specialized treatments. So as we all know that migraine is one of the disease which is associated with the neurological condition where the characteristics are nothing but there will be a unilateral throbbing pain, nausea, photophobia, and sound sensitivity. And many times we see that people are unable to work and they have to be in the dark room, isolate themselves for relieving those problems, those symptoms. And in the conventional treatment, if we see that there are not completely any kind of cure, but most of the medicines what are prescribed are basically as a nerve blocker or pain blocker as well as some kind of painkillers, and they are having a tremendous side effects also, where due to the treatment sometimes the intensity gets slowly the medicine becomes slowly more accustomed, as well as the symptoms starts getting more and more stronger, and the frequency also eventually increases. So in Ayurveda, this migraine has been actually dealt in a perspective of Ardhava Bedaka, that is half half side of the brain is or the head is getting affected, which is more kind of an similar kind of a disease mentioned in Ayurveda. So basically in Ardhava Bedaka, the three dosha predominating, it is a disease which is more impacting because of the vata and pitta imbalance from the three doshas. So it also explains the same symptoms where there is a unilateral head pain, dizziness, discomfort, photophobia, and sound intolerance. So what we do here now, in especially in Germany right now, that when a patient is coming for the treatment of migraine, specifically with the Panchakarma, so we evaluate the whole condition, and then we prescribe the purificatory procedure. So in this purificatory procedure, basically there are five main elements what we are doing. That is one is the internal purification as elimination of the toxins, restoring the balance of the doshas, and then rejuvenation of the body and mind. Uh, in Panchakarma, it is divided into the three phases. The first phase is the preparation phase where we will be giving a different steams. Then there will be an oilation, external and internal, with the help of uh, with the help of the different oils. We will be doing the massages, as well as internally we will be prescribing some ghees, which will be helpful for loosening the toxins, and it will prepare the body for the next phase of the cleansing, which will be done with the help of the virechana, that is the purgation therapy. Then after that, we will be doing nasya, that is a nasal administration of the oil or ghee. Again, this will be helpful for both the reasons, for elimination of the toxins, at the same time for the rejuvenation purpose. And later on, we will be doing a basti therapy, which is nothing but a medicated enema, as well as in the basti also we will be doing some kind of oil enemas. And then there is a third phase where it's a post treatment phase where we will be doing or prescribing a lifestyle routine, daily routine, what they should follow, which kind of a diet they should construct to depending upon their dosha involvement as well as their constitution, as well as we will be giving some kind of herbal remedies for the rejuvenation of the condition. So how the patient is dealt in our center. So first, for the detoxification, so Panchakarma basically helps in detoxification, which is nothing but the doshas which are imbalanced, and then creates the toxins accumulation in the body, which we called as ama in Ayurveda. And these doshas slowly build up on different tissues, which will create the problems. So those detoxification of the doshas will be done, and then after that, the dosha balance will be brought. And to maintain that balance, then we will be advising them how to take care with the help of their lifestyle, as well as the stress relief, because we know that migraine is just not a physical condition, but it is more associated with the mental aspect also. And in this mental aspects, we know that there are different migraine triggers which creates a majority of the impact while having a migraine attack. So for that, we will be also advising them based on Ayurveda how to deal with those triggers and how to prevent themselves from getting into the migraine attack. And then with the help of Panchakarma, again, the circulation, the lymphatic circulation, blood circulation, and neural pathways, all these three things are getting enriched. So there will be a good quality of sleep. At the same time, there will be good energy level in the body. Then there is a medical management, what we will be doing after the Panchakarma also. So there are different herbal as well as herbomineral formulations, which are prescribed and which are available now easily in Germany as well as in the Europe. So the basic things what we will be using, like ashwagandha, turmeric, kurkuma, brahmi. So these are nothing but the adaptogenic, anti-inflammatory, neural tonics. And then we have a specific kind of a therapies where we will be medicated therapies where we will be giving them pathyadikala, that is one of the traditional migraine formulation which has been used since many years for managing this ardhava bedaka basically. And then we have from Santulan Ayurveda, Pitta Shanti tablet, as well as Sankul Churna, which can be taken on a regular basis for, again, for balancing the Pitta acidity in the body and for the cleansing purpose. Then we have this Pranayam Nasya Ghee basically, which helps for clearing the sinuses and calms the nervous system. So there are majority of the therapies, promising therapies, I would say, used in Ayurveda for balancing the doshas, for eliminating the toxins, specifically in case of migraine. Then clinical study also demonstrate that there are many much like many monotherapies or panchakarma therapies which are having very minimum side effects and are very effective. So, in terms of clinical evidence, there are 12 uh, clinical trials based on RCTs and non-RCTs showing a significant result. At the same time, the quality of life of the patient has improved by 85% in reduction of the migraine severity as well as the frequency. So, Panchakarma combined with the herbal medication improves the patient's quality of life as well as reduces the disability score, and it basically prolongs and slowly heal the migraine condition. So this case study demonstrate that there are many effective therapies like Nasya, Virech, and Basti for balancing or creating a harmony in the body. Of course, there are further a large scale research to be needed to bring this Panchakarma therapy on as a mainstream therapy protocol. So what we will be doing here during the when the patient arrives at our center is nothing but we will be doing the initial assessment where the dosha dominance as well as the imbalances are evaluated. Then we will start with the preparatory phase of 6 to 7 days where there will be giving the oil massages, steam, and then the internal ghee therapy. And after that, then we will be having three main therapies, that is the Virechan therapy, uh, purgative therapy. Then after that, there will be a Nasya, that is the nasal administration of the oil or ghee. And lastly, the Basti therapy, which is nothing but the oil enema therapy. And after all this is over, then we will have the post therapy session where we will be advising them to continue some herbal medicines, and also we will be giving them the guideline about their lifestyle for keeping this balance now in the future. So as I was mentioning that this Panchakarma therapy is very much holistic therapy where not only a body is focused, but also with the body, mind and consciousness is also into taken into the consideration. And that's the reason why Ayurveda Panchakarma therapy is giving the maximum effectiveness in relieving the problem. And it is also an individualized therapy where there is no same kind of protocol or administration of the oil or ghee is given for each and every individual. Depending upon the constitution, depending upon the dosha imbalance, we will be actually advising them what kind of uh, oil massages as well as post virechana or post panchakarma therapy, what kind of medicines they have to continue. And after that, the preventive aspect is also one of the main objective in Ayurveda. So for the preventive aspect, it's nothing but your stress management, your diet, your lifestyle, your daily routine, what needs to be taken care, and those all the things will be advised, recommended after complete understanding of the individual constitution and the imbalances. Then when you basically cure your imbalances and you bring your body into the harmony, your dependency comes down from any kind of the pharmaceutical uh, medicine, or you can say a pharmaceutical drug intake. And this is one of the key factor what you have to understand, that you are not going to be on any kind of medication for the lifelong. You can you can eliminate that, or you can come out of the whole cycle by just bringing the harmony in your body. So this is what I would like to conclude the presentation with, where the evidence-based efficacy, clinical evidences which supports the reduction of migraine frequency, intensity, and disability through the detoxification and dosha balance. And the holistic wellness, personalized care extends beyond the symptom control to enhance overall patient well-being and the quality of life. As well as this whole therapy is one of the safest modulation, we can say, where the Ayurveda doctor takes care of that, the whole uh, examination of the patient is done, and then the effective therapy is advised. So this is how we can empower the health with the Ayurveda wisdom in the modern migraine management. Thank you.
Dear Nikhil, thank you for your clear and nice presentation.
Thank you so much.
Nice to hear, and we wish you a nice day to Germany. And
Thank you.
that's
You
it.
too.
Thank you.
Have a nice day. Thank you so much.
Goodbye.
Goodbye.